Hi guys, good evening. This is Dr. Jenny Yusuf, physical therapist and doctor of physical therapy, creator and founder of Balance and Fall Support Group in Aging Adults. I am the founder also of the Physiogen PT and Wellness and creator of the Geriatric Rehab Summit. We did it almost like for 3 years. So this coming July, we will have again the Geriatric Rehab Summit. And tonight, one of our innovators, educators, and also entrepreneurs, our guest for the Thanks God It's Thursdays comes from India. So we are now global, guys. We already interviewed people and therapists from Canada. We have also in other places. We are now global and we would like to learn more from different therapists, clinicians, and if you are in Philippines, magandang umaga. If you are United Arab Emirates, salam alaikum guys, and USA, good evening or good morning, depends on your time. So without further ado, I would like to introduce Omkar Keni. He is the founder of the Athletes World, and we will know more about what is an Athletes World. And that's very unique because the spelling will tell you more. It's different. And Omkar is a certified nutritionist, and also he's a certified nutritionist for diabetic population. So his skills and his training is more on nutrition, making us healthy, and also he's a certified strength and conditioning specialist. All right, so we would like to know more. What are the different things, his wins and challenges? Welcome, Omkar Kenny, to Balance and Fall Support Group. Thank you so much for your time.
Thank you for having me here, Dr. Jennifer. And so I'll just give a quick introduction of myself. Hey everyone, my name is Omkar. I'm the founder of Athleatsworld. And the spelling of Athleatsworld, like Dr. Jennifer was saying, is ATHLEATS. So the eats, what we use in eating food, that is the spelling of Athleatsworld. And why Athletes World, specifically that name? Because I believe that not all my clients are athletes. In fact, most of my clients are working professionals who sit in front of a laptop or have a really busy schedule. And some people ask me why the name Athletes World. So here is my answer. What I believe is each and every person on this planet is an athlete, and each and every person needs to perform. Like, not only athletes need to perform in the field, but let's say if you are a physiotherapist like Dr. Jennifer, she needs to go from one place to another. She needs to visit different patients, teach them different exercises, keep on speaking continuously. She needs to be sharp from here. She needs to make decisions quickly, right? So if you're a business owner, you need to be sharp, you need to be fresh throughout the day. So you are performing, right? So like, just like an athlete is performing, you are also performing in your own field. So that is why I came up with this name, Athletes World. And at Athletes World, what we do is we make the process of getting healthier and fitter really easy for people who lack the knowledge of nutrition or strength and conditioning. And what we do is basically we help people lose weight. We have helped people reverse their type 2 diabetes. We have helped people improve their hypothyroidism, work on their PCOS. Okay, so these are all the things we'll do. On top of that, I have had people who had ankle swelling or joint pain, knee pain. So since I'm a strength and conditioning specialist also, I gave them some specific exercises which have improved their joint health also. So yeah, that is what we have been doing at Athletes World. And this is the third year running that it's actually been 2.5 years since I have started Athletes World.
Wow, that's really good. It's like a niche already. You already
Yeah.
informed us who are the people you're treating and the different benefits. And I like the story of that everybody is athlete and we need to be sharp and performing. That's true. Every time I treat myself, I told to my client, all right, you are the athlete here, I'm your coach. you know. So although I'm a physical therapist and you're my student, I'm your teacher. So we are really wearing different hats. Now I feel that I'm an athlete too because you told me that. That's true. We need
Yeah,
to be sharp and we are what we eat. So you spelled
yeah,
to them what is Athlete's World. Thank you so much for sharing that. But before your journey, you already undergo like training. So what other training you did other than those skills like nutritionist, how many months of that, and then the diabetes, why you prefer to focus on diabetes and other things like hormonal issues in your field?
yeah.
Why not go architecture and engineering, right?
Yeah, so to like to give you a brief background, I had done my bachelor's degree in commerce, so I have a BCom degree. I'm a BCom graduate. But honestly, I didn't have any interest as such in that. My inclination was always towards sports, fitness, health, and things like that. Uh, Also, like I think I had told you, I am a semi-professional football player also. So I am an athlete, and I do play football. So along with that, I was never, into commerce or things like that. I was actually always into health and fitness. And then what happened is in 2018, I had an ACL tear. Okay, so you must be very well aware what is an ACL tear. So I had an ACL and meniscus tear for which I had to get operated, and I got it operated, and after that, if an athlete has to return to the field, it is a road of 6 to 8 months that you have to do very serious rehab, right? So in those 6 to 8 months, I was like, what should I do since I'm not on the field? I have some extra time, and I thought that if I had the knowledge about nutrition at first place and about exercises which will benefit me, so I thought it will be great for me. Then I just saw which is the best academy around in my place, near my place. So what I did is I googled something, and there is an academy called K11 Academy of Fitness Sciences in India, which is the best academy for trainers to get certified related to nutrition or even personal training. So what I did is I just enrolled in their program. I went through their program, and by the time my ACL rehab was almost done, I was also a certified nutritionist. And yeah, since then it was so I started my practice in around 2019, I guess. I had not started Athletes World back then, but I was practicing like maybe my family members, maybe my friends, maybe some of my neighbors who so my first client was my father himself. He was really obese, and as everyone say, diabetes runs in our family. It was same for me. Like my father, I would say, was literally point 0.1 mark behind the type 2 diabetes HbA1c marker. So he was overweight. He was almost borderline diabetes, and today he is far away from diabetes. He is really healthy. So he was my first client, and then seeing his results, the people around in my society, my friends, all started coming to me, and then I thought, let's start something of my own, and I came up with Athletes World.
That's really good. You're a great inspiration for young adults, especially you're so young and you have your own company. And that's really very nice, great company because you mix the exercise and nutrition combined, you know. So we have many exercises here, physical therapy clinic, and we have pure nutritionists alone doing education. And but with you, you do your own exercise program and you have your diet program. So we are looking forward to learn more from that. So what will be your wins? Or first you have a win right now. Your dad is your first client and you see the progress. And we ourselves, our family are also diabetic. All our generations, we have first cousins, they are only under 40s and they have already diabetic. diabetes. So it's really important for us to learn more about proper nutrition and exercise, the benefits. Can you tell us a little bit science? People listening right here are not all clinicians. We have clients and caregivers to people who are not familiar. What is diabetes? Can you explain what's the big difference between diabetes type 1 and type 2 and why type 2 is exercise will be very important for that? Thank you,
Right.
Omkar.
So, sure, Dr. Jennifer. So, the main difference, okay, I'll start with what is diabetes. So, see, there can be various reasons why people tend to get diabetic. Now, okay, I'm not talking about the genetic thing because, honestly, what I feel is when we say that diabetes runs in our family, right? So I used to also believe that my grandmother had diabetes, so my father will have diabetes, and maybe I will also have it in the future. But it's not like that. When I did all these certifications, what I realized is the food that my grandmother was eating, same thing was eaten by my father. And if I keep on eating the same thing, we are actually passing down the diseases through our kitchen food, not through our genetics. So the first step has to be from our side is to improve our lifestyle. Okay, and what is diabetes? Basically, when it happens through food, it is like your uh, you eat a lot of sweets and processed food like bread or sweets or chocolates or things like that. What it does is it makes your body insulin resistant. Okay, so if I were to explain you insulin resistance very short term and short and simple term, it is, you can say, your body loses the ability to tolerate the amount of glucose and other junk that you're eating. Okay, so you may not be affected in your teenagers or in your early 20s also, but as and when you age, as and when you cross the age of 30, 35, 40, slowly your body starts resisting it. And what happens is it leads to hormone imbalance and your blood sugar starts going up. And then there is a point when your body can't take it anymore. So then comes up type 2 diabetes. Okay, so the type 2 diabetes, the difference between type 2 and type 1 is type 2 is acquired later on in life, whereas type 1, many people have it from younger age. Like I have a friend who is 20-year-old and his sister is 15-year-old and his sister has diabetes at 15 years of age. Okay, it is type 1 diabetes. So the difference is type 1 diabetes is not reversible. Type 2 diabetes is completely reversible. Like I have myself brought people from 8.0, 8.4 HbA1c to 5.0 HbA1c. So that is completely reversible with the healthy lifestyle, right lifestyle. And type 1, though type 1 diabetes is not reversible, people who have type 1 diabetes, I will have one strong suggestion for them. Just because it's not reversible, don't give up on your health. Okay, so diabetes have a lot of complications like neuropathy, nephropathy. Unfortunately, I have seen people, I am in some diabetic groups on Facebook, and I have seen people who required to unfortunately cut their toes or something like that because their toes were swollen so much. So the thing is, I would suggest people who have type 1 diabetes, it doesn't mean that if you follow a healthy lifestyle it won't help you. The thing is, uh, all the harmful things or harmful effects of diabetes that you may see at 40 years of age, if you follow a good lifestyle, maybe you'll see them at 60 years of age. So at least you will live those 10, 15, 20 years with ease, without depending on anyone, without depending on a wheelchair or medicines or things like that.
Yeah, I really like what you said there. It doesn't mean that type 1 is like this, exercise will not be improved, so I'll just depend with my medicine and then just like that. So both exercise really both help, and then you're changing your lifestyle. You are what you eat, so that's really important. Cleaning first the kitchen, if you expose yourself with all the junks, just like for the kids, if you showed cookies and junk food on the table, that's what they will eat because that's what you're showing,
Yeah,
right? So if we put something like healthy, like fruits on the table, because that's what's available, so that's what we need to practice and change within ourselves
yeah.
first. So that's discipline. That's a good tip, and thank you so much, Omkar, about that. I
And
I
Dr. Jennifer,
totally,
sorry to interrupt
yeah.
you. I
Go
would like
ahead.
to add another point. I would like to add another
Hmm.
point for parents specifically. Uh,
Okay. Oh yes, yes,
I
please.
mean, the point I had also made a post about this on LinkedIn and Instagram, I guess. So the thing is, when if you want your child to be healthy, it has to start from you. Like if you observe when your child does some mischief or doesn't listen to you, that is a child's tendency. They don't listen to you, they will follow you, right? Let's say you are going to supermarket, they will be like, I also want to go. Let's say you are working out, they will also try to do something along with you. So the thing is, they don't listen to you, they follow you. So it has to start from you. If you want them to be healthy, eat healthy, you have to start it first.
I love that. That's true. We should be a good role model. I
Yeah,
remember that. That's really nice. It strikes to me because when I keep doing something, some exercise, my daughter, I'm watching the videos and then she will also change her outfit because I'm already in the living room. And then she said she will join me. But if I'm not doing that, but I didn't ask her to join me. But she sees that I am doing something,
yeah,
she will join. That's really good. And that's a good bonding too for the family if you're doing something like that. Good point.
yeah,
We are a good role model. I like when you say they don't listen to you, but they will follow what you do. All right. So we do a tips already for the parents, and also how about like their diet time? Diabetes is very complicated. I have a patient that I told to my mom, you need to eat on time. You should have your body like a routine. I have a patient that I cannot treat on the specific time because she's eating around that time and she's diabetic. Can you tell us more how important the good timing and then the right timing of the food for them so they will know that it's for the patient themselves listening right now that it's not good to skip your meal or I just eat whenever I'm hungry or something like that. Thank you so much,
yeah.
Omkar, for your knowledge.
Sure, Dr. Jennifer. So this is my golden rule. Okay, what I'm going to tell you now, it is one of the secrets of my clients maintaining their health for long term. So the key or golden rule that I tell my clients is, usually, like you said, we have a habit of eating time to time. So now my answer will be broad, but it may differ from case to case. Like, let's say a person wants to lose weight, my answer for them will be different. Let's say a person wants to gain muscle, my answer for them will be different. Okay, now I'll specifically talk about losing weight because our topic has been around that. So the thing is, talking about people who want to lose weight, here's my golden rule for them. So what I tell my clients is, only eat when you are really hungry, and whenever you are hungry, when you sit at your dining table, don't leave your table hungry. Like, don't eat less and don't overeat also. Okay, so whenever you eat till you are full and satisfied, then get up, and for your next meal, only have your next meal when you are really hungry. Okay, so now how this rule helps and why I have kept this rule for my clients, because what happens is, let's say I have a client who is working a 9 to 5 job. Okay, so what happens is, at least where I live, most of my people travel for around 45 minutes to 1 hour a minimum, okay, considering the traffic and everything. So since they have to leave at 8 a.m., what people will do is, they will try to have the breakfast at 7:45. Why? Because they will have this thing in their mind that, oh, I have to leave at 8 a.m., so let's have my breakfast, and I'll leave for my office. But the thing is, because of this schedule, then let's say they have the breakfast at 7:45, then they go to their office, and at 10 a.m they think, okay, let's have some fruit, then they'll have lunch at 1 p.m. So what happens is, in such a schedule where they have fixed timings, people, a lot of times people forget to listen to their body. Like, fact is, most of the people are not even hungry in the morning. Okay, so some people are hungry, some people are not. But even though they are not hungry, because their body has a habit of just gulping down food in the morning, they will go to the kitchen and grab something and eat something. So what I tell my clients is, ask yourself, am I really hungry? And if the answer is yes, I am really hungry, then have something. If the answer is no, I'm not really hungry, then maybe you can just hydrate yourself, drink water, and then leave for your office. Maybe later on, when you are hungry at 9:30 or 10, you can carry some small tiffin, or you can reach your office place and have your food. So that's the one suggestion I would like to give to all the people.
Yes, that's thank you so much for that tip. And I always hear that try first to drink water because sometimes you're just thirsty and not hungry. And once you
Yeah,
drink the water, you will feel that you're full already. So sometimes I feel that I thought that breakfast is the best meal in the day. So people are always eating, right? So that's why whenever they before they work, some of them they just drink, but it's a habit, you know. Some of them they just drink
yeah,
coffee. It's like a heavy meal. But we Filipinos, we eat rice in the morning. When I was in Philippines, that's a heavy meal. We have a big breakfast. But here now in
yeah.
America, everybody's rushing. Everybody's diet are different. So these tips are very wonderful. Thank you so much, Omkar. I know we will learn more from you and your company, the Athletes World. You have the exercise routine in your app, and then also you provide nutrition as your the consultant in the company. So how can we connect with you? So if is it only diabetes, people with diabetes will be your client, or let's say people are listening right now, they want to lose weight, right? So that's first mainly is your client, and
Yeah.
then if they are diabetic, of course, that's your client. And who else will benefit from your
So,
program?
yeah. So people want to lose weight, people who have PCOS, people who have hypothyroidism, people who have type 2 diabetes and want to possibly reverse it uh, can get a lot of help from this program. And also another thing, uh, recently I got a client who has type 2 diabetes, but he is not overweight. Okay, so a lot of times what happens is, even though people have type 2 diabetes, yeah, maybe they might have some belly fat here and there, but the thing is, that particular client was not overweight. So in that case, I have to be very careful, and I have to reverse his diabetes, as well as I need him to gain muscle mass. Okay, because I would say there is a hidden pandemic going on in the entire world, which is muscle atrophy, or I would say in simple terms, loss of muscle mass. Okay, so our population, most of the people lack good quality lean muscle mass, and because of that, people experience early aging. So even for your clients, like your patients, physiotherapy patients, uh, people who have knee pain, joint pain, or ankle pain, let's take an example of knee pain. So a lot of times, why knee pain happens, obviously, your your body, if you're overweight, your knee has some additional burden on it. But that's another part of the story. One main thing which has to be addressed is, the muscles around your knee are not strong enough to support that joint. Okay, if you strengthen it, if you build muscle, then it can really help you resolve your knee pain. And similarly for diabetic people, like for example, the client I had recently, so he needs to gain muscle as well as reverse his diabetes. So having good amount of lean mass is very important. Now when I'm saying gain muscle, people think that, oh, I need to be a bodybuilder or what. It's not like that. You don't need to be a bodybuilder. Every person has lean muscle mass. Even a 2-year-old baby has muscle mass. Okay, every human being on this planet has muscle mass. Just the amount of muscle is different, and everyone should have some amount of lean muscle mass, good quality lean muscle mass, so that they can be strong enough. So yeah, if anyone wants to strengthen their bones, joints, even anyone wants to gain muscle, if they have if they lack if they lack good quality muscle mass, then this program will help them also.
Yes, that's good. Yeah, I tried your program. We keep doing some of the program. We only speak, and then we're making a plan, changing my diet. So just only for a week, we're able to successfully reduce 5 pounds. And you said some people are able to do that for a month. They have difficulty in only a week, right?
Yeah,
So
so
I was
right.
surprised. I didn't know like that. But for me, I know that's easy to lose in a certain, because sometimes that's fats, that's water, but I didn't know that it's really difficult that much. So I don't
Yeah.
I'm thinking it is. So but I really like you just talk and change my routine, and that's helpful, and that's really good, because sometimes it's also cleansing, right? It's not always a diet itself. Sometimes it's a cleansing on, and I have more understanding if I'm doing those routine in the morning, it's pure carbs, and you explain what is better with the protein, things like in water. So that's really educational, just learning from you on the nutrition aspect, because physical therapist knows already exercise, and we just don't do it regularly, but we are familiar. So we are thankful, and I believe physical therapists, clinicians, and anybody who has hormonal issues and endocrine issues like the diabetes and the other hypothyroidism will help in your knowledge. And then how can we connect with you? And do you have a certain program promotion for our listeners, like for the balance and falls, that we can try, so we can see if it works for us, something for them?
Yeah, sure. So to connect with me, like I think Dr. Jennifer had posted a highlights Monday interview. So in that also I have mentioned that you can connect with me through Facebook DMs. You can send me a friend request. I accept all the requests. So you can send me a friend request. You can connect with me through LinkedIn. I have mentioned given my link over there also. And apart from that, I have my website, which is athletesworld.com. So you can go on that website. You can see how many people like yourself, I mean people watching this video, have been benefited from the program. And over on my website I have a feature called a free strategy session. So anyone going to my website and wants to talk to me and get to know their problems in details and what could be the possible solutions, they can book a free strategy session with me. uh, not many people do such a call for free. I give them complete 50 to 60 minutes of my time and of their time. So I take out this time just to learn their challenges, like what are the challenges that they're facing in terms of their health and fitness or their fitness journey. So I take out the time to understand that. I get a detail about their schedule and everything, and then I give them a few points for them to get started immediately. And then if they want to work with me personally, if they want to join my program, then I tell them the details about the program on that call itself. So it's a 12-week program basically. I have intentionally not kept a crash program like many. I've seen many people keep a many trainers keep a 28-day, 30-day program. So the thing is, in terms of health and fitness, it is 28 to 30 days a really short period to see any results. Okay, even though Dr. Jennifer, you have seen results like you have reduced 5 pounds in 5 days. That is extraordinary. It doesn't happen with everyone, though
Maybe
most
my
of my
weighing
clients see
scale
results.
is wrong.
No, no, I don't think so. Anyways, like it is most of the clients, though they see the results in first week or 2 weeks, still, to get sustainable results, to know your body, 12 weeks is the bare minimum. So that's the one plan that I have kept. And yeah, so that is how I work. And like I said, if you want to contact me, you can contact me through Facebook, LinkedIn. I will also provide my business WhatsApp number to Dr. Jennifer. If anyone messages her, she can give you my business WhatsApp number also. And yeah, you can connect with me. Definitely, I will help you out.
Yeah, I can post exactly your WhatsApp number. Is that your business WhatsApp number? Is it
Yeah.
okay to
You can
post in
post
the
it.
yeah. So if
Definitely.
that's
In
the
the group, it's
business
fine.
WhatsApp, that's good. So I can post guys the WhatsApp itself because this will be in different platforms. So I don't really have a control who will call you and everything. So that's fine.
Yeah.
So as long as it's your business and you said you accept everybody in Facebook.
Yeah.
So you accept everybody, huh? All right. Thank you
Yeah.
so much, Omkar. We really appreciate you. You're so young and but very talented at at this stage of your life. You already know lots of things and you really help a lot. I see your website. And then it's nice to see the before and after always, right? It's always nice to
Yeah.
see those. Okay. Thank you so much, guys. If you have any questions, so that's a 12-week program. Connect with Omkar. If that works for you, you can talk to him. That's really important to fight diabetes. And also hormonal issues are very, very serious. And that's why we are sometimes bloated because that's the hormones itself. Hypothyroidism, the PCOS, they are really related to each other. And the PCOS and diabetes too. Yeah, and then
Yeah.
the overweight. So that's a pandemic of the obesity. So there's a solution. Would like to be part of the solution. So thank you so much, Omkar. We appreciate your presence in Balance and Falls Support Group. Thank you
Thank you,
guys
Dr.
for
Jennifer, for
watching.
having me here today.
Yes, you are welcome. So thank you so much, guys, for listening. I hope you learned a lot and connect with us. In any questions, connect with us. All right. So we are from Physiogen PT and Wellness. You are listening with the Balance and Fall Support Group. We are available in Facebook. All right. Any questions? So it's me again, Dr. Jenny, geriatric clinical specialist and certified exercise expert in aging adult. I'm the current vice chair of the Global Health in Aging, a special interest group of the Academy of Physical Therapists Association. Thank you so much, guys, and we would like to invite you for the Geriatric Rehab Summit. It will be on July 29 and 30. Omkar also will be one of our speakers. We'll talk about more about nutrition and obesity, diabetes for all the other listeners there. So thank you, Omkar, and thank you, everyone. Bye for now.
Bye bye.